Hello, you are very welcome to the Mastermind channel. Today we're going to talk about certain types of personality disorders. Personality is a set of characteristics that distinguishes us from each other and influences our thoughts, emotions, feelings, and behavior. The factors which influence a person's personality have different origins and can be genetic or environmental. According to the Diagnostic Manual of Mental Disorders, a personality disorder is a stable pattern of inner experience and behavior that departs markedly from what is expected to the individual in a given culture, is intrusive and inflexible, and begins in adolescence or early adulthood, is stable over time, and gives rise to distress or disability. There are several types of personality disorders. The first group includes paranoid, schizoid, and schizotypal personality disorders. Another group includes antisocial, borderline, histrionic, and narcissistic personality disorders, in which individuals tend to appear dramatic, emotional, or make the same mistakes repeatedly. The third group includes avoidant, dependent, and obsessive compulsive personality disorders. These individuals have a high propensity to experience anxiety and fear. The characteristics of a personality disorder become more evident during adolescence and adulthood. Some types of personality disorders tend to become less obvious or disappear with age, namely antisocial and borderline personality disorders. Today we will talk about the first group of personality disorders, namely paranoid, schizoid, and schizotypal personality. Individuals with these personality types tend to isolate themselves, have emotional coldness, and are referred to by others as oddballs. And for this reason, they have difficulty relating to each other. These three personality types have similar characteristics and can be indicators of an evolution towards schizophrenia. The most important characteristic of the paranoid personality is added confidence. Individuals question the fidelity of friends, family members, and spouses, and are keen to detect betrayals, make distorted interpretations of compliments, constantly suspect evil intentions in the neutral behavior of others, and are always in a state of alertness, under threat, without real or apparent grounds. For this reason, they often react impulsively and with an aggressive, inflexible attitude. They assume rancorous attitudes with ruminative thoughts about past events in order to validate their mistrust. People with a schizoid personality disorder have a pattern of withdrawal from social life and restrictive emotional expression. Some of the characteristics are lack of intimacy in intimate relationships, isolation, including from family, frequent solitary activities without any pleasure in them, no friends or companions. Their relationships are usually restricted to their close relatives. There are people considered by others as apathetic. They also have emotional coldness and lack of empathy. Schizotypal personality disorders is a pattern of instability in close relationships, cognitive, cognitive or perceptual distortions, and eccentric behavior. Its main characteristics are strange beliefs or magical thoughts, superstitions, telepathy, clairvoyance, sixth sense, among others. The person may believe that someone did something as a consequence of a thought they had, feeling they have power and control the people around them through the power of their thoughts. Persecutory ideas, disorganized thoughts and speech, strange appearance in terms of wardrobe, showing lack of self-care, strange behavior with unusual experiences in terms of perception, body illusions, even feeling the presence of someone who is not present, hearing voices, among other sensations. As a consequence of these characteristics, these people have no friends. These personality disorders can be a stimulus for schizophrenia. It is important to have a diagnosis made by a mental health professional in order to minimize the consequences of this disorder. Treatment may require the use of drugs. Occupational therapy may be beneficial in these patients. So we're done for today. I hope you liked this video. If you liked it, leave your like. And if you haven't subscribed to this channel yet, subscribe. And don't forget to share this video. So thank you for staying until the end, and I'll see you next week. Bye now.